The Idaho Department of Health and Welfare gave an update on how COVID is impacting its healthcare system.
This all comes just one day after crisis standards of care were put in place for Idaho's 3 southern districts. That decision was caused by high numbers of staff calling out because of either positive tests or COVID exposures. The Department of Health and Welfare also said that case numbers are headed in the wrong direction. Hospitals in southern Idaho and really all across the state are also dealing with the impacts of the nationwide blood shortage and this surge in Omicron cases. Crisis standards of care have not been put in place though for Idaho's 2 northern districts, though the Panhandle isn't past this current surge yet.
The situation with the healthcare systems for the rest of the state remains very fragile. If current trends continue, I expect that crisis standards of care will be activated in additional areas of the state.
So North Idaho right now not enacting those crisis standards of care yet, but health officials caution, as he mentioned, that could certainly change if trends continue. Down at Pullman Regional Hospital, though, things are going a bit differently.
As of this morning, the hospital reported that it was not treating any COVID patients. According to Pullman's Regional Hospital's chief nursing officer, they're in the same boat as other hospitals when it comes to staffing issues. However, as Omicron has swept through Washington, more and more healthcare workers are contracting the virus or being out due to exposure. The hospital is still dealing with very sick patients, but not just due to COVID.
We still are seeing a surge of very sick people, not COVID patients in particular, but I do believe that we're seeing higher levels of very sick people because people have delayed care.
She also said that even healthcare workers have put off treatment due to just being so busy taking care of patients. As for the current cases in Pullman, she says more and more young people are testing positive for the Omicron variant.
So the question is, how are the hospitals doing in Spokane County? KREM 2's Ian Smay is tracking a big spike in hospitalizations, plus why Spokane healthcare leaders say they're concerned about what's happening with COVID in North Idaho.
Hospital leaders said hospitalizations statewide are still increasing, but at a slower rate than previous weeks. But when it comes to Spokane County, they say hospitalizations have seen a significant uptick in recent weeks. According to the Hospital Association's Executive Vice President Taya Briley, Spokane County has seen a 23% increase in hospitalizations in the past week. Over the past 2 weeks, the number of people hospitalized with COVID-19 has doubled here in Spokane from about 80 patients to about 160 patients. This comes as hospitals across the state have faced a tough week.
Last week was an extremely rough week for all those in our state who needed access to life-saving hospital care. Hospitalizations were trending up and staff continued to call out sick because they had either contracted COVID or they were having to isolate due to exposure.
Another worry for hospitals, especially those in eastern Washington, is the current situation unfolding in Idaho. Yesterday, the Idaho Department of Health and Welfare activated crisis standards of care in the state's 3 southern health districts. It is yet to activate these standards again in North Idaho. Last time there were crisis standards activated, it had effects on hospitals in eastern Washington as they saw an increased demand in transfers or people from Idaho coming to Washington for treatment. Briley says they are prepared for North Idaho to also be in crisis standards.
We are concerned that crisis standards will spread north in Idaho. In the prior crisis stage, when Idaho declared crisis standards of care, it began in the north and then spread south. And Washington hospitals were definitely affected.
The Hospital Association said it is also placing a large order with 3M for more N95 masks. They said a lot of hospitals across the state are operating in contingency standards when it comes to PPE. That means workers would use an N95 mask for an entire shift instead of changing it after each patient. One thing that Briley brought up was the effects of vaccines. She said since the vaccines were rolled out, about 90% of hospitalizations and deaths could have been prevented with a vaccine. In the newsroom, Ian Smay, KREM 2 News.